Hello, my friends. I'm Dr. Linda Parker, and today I want to talk to you about something that almost no one asks for at the doctor's office, but should. It's not a new miracle pill, it's not a trendy supplement, and it's not an expensive scan. It's a simple blood test. One small number on a lab report that can quietly predict your future health far better than the good and bad cholesterol numbers most people obsess over. Yet most adults have never even heard of it, and many doctors still don't order it unless you specifically ask. I've spent decades sitting across from men and women who were told for years, "Your cholesterol looks fine, everything is normal," only to end up with a heart attack, a stent, a stroke, or sudden chest pain that changed their life overnight. They look at me in disbelief and ask, "How did this happen if my numbers were always okay?" And the painful truth is this: the standard tests we've relied on for years simply don't tell the whole story. You can have normal cholesterol and still have a very high risk of heart disease. On the other hand, you can have slightly high cholesterol but a much lower actual risk than your numbers suggest. That's why, in this video, I want to walk you through the one blood test you must at least know about and consider asking for, especially if you're over 50, have a family history of heart disease, or simply want to protect your heart, brain, and circulation as you age. By the end, you'll understand what the test is, why it's more precise than traditional cholesterol, how it helps you and your doctor make smarter decisions, and how it can give you something that no pill can buy: clarity and peace of mind about your cardiovascular future. So let's start with a scenario that might sound familiar. You go in for your yearly checkup. Your doctor orders routine blood work. They check your total cholesterol, your LDL, the so-called bad cholesterol, your HDL, the good cholesterol, maybe your triglycerides. A few days later, you get a phone call or a message. Everything looks okay, no major concerns. You breathe a sigh of relief. You keep living your life exactly the same way. Then, 2 years later, you're in the emergency room with chest pain. Or a friend of yours who also had good numbers suddenly needs a bypass. You think, if the test said I was fine, why wasn't I really fine? The answer is that traditional cholesterol tests measure how much cholesterol is floating in your blood, but not how many dangerous particles are actually carrying that cholesterol and crashing into your artery walls. Think of cholesterol like cargo and your blood as a highway. The standard LDL test tells you roughly how much cargo is out there, but it doesn't tell you how many trucks are on the road. You can have a small number of trucks carrying a lot of cargo or a massive number of trucks each carrying a little. It's the number of trucks that jams the highway, causes accidents, and damages the roads. In your body, those trucks are the cholesterol-carrying particles that can infiltrate your arteries, trigger inflammation, and gradually create blockages that lead to heart attacks and strokes. The test I want to talk about today focuses on those trucks, not just the cargo. It's called ApoB, short for apolipoprotein B. You don't need to remember the scientific name, but you do need to understand the idea behind it. ApoB is a protein that sits on the surface of every potentially dangerous cholesterol-carrying particle. The LDL particles, the VLDL particles, and others that can contribute to plaque in your arteries. Each of those risky particles carries one ApoB molecule, like a little flag. So when you measure ApoB, you are not just estimating how much cholesterol is out there. You are literally counting how many atherogenic particles, how many trucks, are on your blood highway. Why does that matter so much? Because the damage to your arteries depends more on how many of these particles are repeatedly bumping against your artery walls than on the total amount of cholesterol they carry. Each particle is an opportunity for trouble. The more particles you have, the higher the chance that they will enter the lining of the blood vessel, get stuck, and trigger the inflammatory process that leads to plaque buildup. ApoB gives you and your doctor a much clearer picture of that risk. Now, let's translate all this into something practical. You might be wondering, isn't this just another number to confuse me? Actually, it's often the number that makes everything finally make sense. Imagine two people, both with an LDL cholesterol of 120, which many would consider borderline or even acceptable depending on age and overall risk. Person A has a low ApoB, fewer particles, each carrying more cholesterol. Person B has a high ApoB, many more particles, each carrying a bit less cholesterol. On paper, their LDL looks the same. But the person with the higher ApoB is at much greater risk because their arteries are being assaulted by far more trucks every single day. Without ApoB, both people get the same message. Your LDL is similar. With ApoB, you can see clearly who really needs more aggressive protection and who may be safe with lifestyle changes alone. This leads directly to the first major benefit of asking for an ApoB test. Early, precise warning before symptoms appear. Heart disease is often called a silent killer for a reason. Plaque builds up quietly over years. Standard cholesterol can lull people into a false sense of security. ApoB can reveal hidden risk even when the usual numbers look fine. If your ApoB comes back high, it's like a flashing yellow light saying, slow down, pay attention, take action now while there's still time to change the road ahead. If it comes back in a healthy range, you get the reassurance that your particle count is under control and that your current habits and treatments are truly protecting you. The second benefit is that ApoB helps cut through the confusion and fear that many people feel when they see their lab results. Patients tell me all the time, my HDL went down a little, my LDL went up a little, my triglycerides are kind of high. What does any of this even mean, doctor? They feel like they're trying to interpret a foreign language. ApoB lets us simplify the conversation. Instead of juggling 5 different numbers, we ask a more direct question. How many atherogenic particles are out there? If that one number is high, we know we need to work on reducing your risk. If it's well controlled, we know that the overall picture is far less alarming, even if one of the traditional numbers is not perfect on its own. The third benefit is about treatment decisions. Too often, patients are either put on medications they may not truly need, or they refuse medications that could save their life because the conversation is based on vague cholesterol categories instead of precise risk. ApoB can help avoid both extremes. For someone with moderately high LDL but a low ApoB, a doctor might decide that focusing on lifestyle, nutrition, physical activity, managing stress, improving sleep, is enough for now while keeping an eye on trends. For someone else with only mildly elevated LDL but a very high ApoB, their doctor may say, your risk is higher than this LDL number suggests. I strongly recommend we do more to protect you. In other words, ApoB doesn't push everyone toward more medication. It helps tailor treatment to the real risk, which is exactly what good medicine should do. The fourth benefit is that ApoB is a powerful way to track the impact of your efforts. Many people change their diet, start walking daily, lose a bit of weight, and then feel discouraged when their standard cholesterol numbers barely move. But sometimes, those lifestyle changes significantly reduce the number of dangerous particles long before they dramatically change total cholesterol. When we recheck ApoB after a few months of consistent healthier habits, I often see the number drop, even when LDL is only slightly improved. That can be incredibly motivating. You get objective proof that your effort is working at the microscopic level, that your arteries are being exposed to fewer damaging particles day after day. On the other side, if your ApoB stays high, despite changes or despite medication, your doctor knows it's time to adjust the plan instead of assuming everything is fine. The fifth benefit is that ApoB doesn't just speak to your heart. Those same particles can also damage the small vessels in your brain and kidneys. Over time, poorly controlled atherogenic particles are linked with cognitive decline, mini-strokes, and kidney problems that rob you of independence and vitality in later years. When you lower ApoB, you're not only protecting yourself from heart attacks, you're also helping preserve your mental sharpness, your balance, and your ability to live life on your terms as you age. This is about more than surviving longer. It's about staying clear-headed, mobile, and connected to the people you love. So who especially should consider asking their doctor about ApoB? If you have a strong family history of heart disease, especially if relatives had heart attacks or strokes before age 60, this test can be extremely revealing. If you have prediabetes, diabetes, high blood pressure, or abdominal obesity, your arteries are under multiple stresses at once, and ApoB can show how aggressively those stresses are affecting your blood particles. If you've ever been told that you have borderline cholesterol, but something in your gut still doesn't feel right, this test can help resolve that uncertainty. And if you're already on cholesterol-lowering medication, ApoB can show whether the treatment is truly optimizing your particle number or if there's room for adjustment. Now let's talk about the practical side. How do you actually ask for this test without feeling awkward or demanding? It's simpler than you think. ApoB is a standard blood test that can be added to your next lab order. During your appointment, you can say something like, "Doctor, I've been learning about ApoB, the test that measures the number of atherogenic particles. Given my age and family history, I'd feel more comfortable if we checked it at least once. Would you consider adding it to my labs so we can get a clearer picture of my risk?" This type of respectful, informed question doesn't challenge your doctor's expertise. It shows that you're engaged and serious about your health. Most clinicians appreciate that. If your doctor isn't familiar with ApoB or seems hesitant, you can calmly ask, "From what I understand, ApoB can sometimes catch risk that traditional cholesterol misses. Is there any medical reason it wouldn't be useful in my case?" You're not arguing, you're inviting a thoughtful explanation. In many cases, a doctor may simply need a moment to think it through or to look up the latest guidance. You're allowed to start that conversation. It's your body, your arteries, your future. Being part of the decision is not just your right, it's your responsibility. I want to share a few brief examples, not as promises, but as illustrations of why this one test can be so powerful. A 62-year-old man came to me after being told for years that his cholesterol was a little high but not terrible. His total cholesterol wasn't dramatic, his LDL was modestly elevated, and he had no symptoms. But his father had died of a heart attack at 58. Something didn't sit well with him. We ordered ApoB. The result was significantly high. His particle number told a very different story than his basic cholesterol. That one result changed everything. We had a serious talk about nutrition, daily walking, and weight loss. We also started medication, not out of fear, but out of clarity that his arteries were at real risk. 6 months later, his ApoB had dropped dramatically. He felt stronger, he slept better, and he moved from uncertainty to confidence that he was finally addressing the true problem. Another patient, a 70-year-old woman, had been terrified of taking any medication. Her standard cholesterol panel looked concerning, with a higher LDL and low HDL, and she felt pressured and overwhelmed. She told me, "I don't want to take pills for the rest of my life if I'm not even sure I need them." So we ordered ApoB. To her surprise, her ApoB was not as high as expected. Her lifestyle was better than she gave herself credit for. We decided to give her a trial period of intensive lifestyle changes, more movement, better fats, more fiber, less sugar, and then recheck. 3 months later, her ApoB had fallen into a comfortable range. We avoided starting a medication she deeply feared, and she gained trust in her own ability to influence her health. Again, ApoB didn't push her toward more treatment. It helped us tailor the best approach for her. The third example is a man in his late 60s who already had a stent placed after a heart attack. He was on several medications and assumed, "There's nothing else I can really do." He saw his situation as fixed. We measured ApoB and found it still higher than ideal, even with treatment. That result became a turning point. Instead of accepting, "This is just how it is," he decided to get more involved in his own care. He added regular walking, small changes to his meals, and a focus on consistent sleep. We fine-tuned his medications. Months later, his ApoB came down significantly. He felt more energetic, less breathless, and most importantly, he felt empowered. He went from being a passive patient to an active partner in his own recovery. I want to be very clear. ApoB is not magic. It doesn't replace every other test. It doesn't guarantee you'll never have a problem. No single number can make that promise. But it gives a clearer window into your true cardiovascular risk than many people have ever had, and that clarity is incredibly valuable. When you know your ApoB, you and your doctor are not guessing based on averages and categories. You're looking directly at the particle burden that your arteries face every day and making decisions based on that reality. So as we begin to wrap up, let me bring everything into one simple sentence. The one blood test you should strongly consider asking for, especially if you care about protecting your heart, brain, and circulation as you age, is ApoB, because it counts the actual number of atherogenic particles that drive cardiovascular disease, giving you a much more precise understanding of your risk than traditional cholesterol alone. It's never too late to take control of your health story. Whether you're 45, 60, 75, or beyond, there is always value in gaining better information and making choices that support your longevity and vitality. Asking for an ApoB test is not about being afraid. It's about being informed. It's about saying, "I want to understand what is truly happening inside my body so I can make the best decisions for my future." Combine that information with daily habits that support circulation, stable blood sugar, healthy weight, strong muscles, and restful sleep, and you're stacking the odds in your favor in a powerful way. If this conversation resonated with you, I invite you to reflect on your last blood test. Did anyone ever mention ApoB to you? If not, now you know there is one more tool you can bring into the discussion at your next appointment. Share this video with a friend or a family member who has normal cholesterol, but a nagging worry about their heart health. Sometimes, one piece of information at the right time can change the trajectory of an entire life. And if you'd like to keep learning how to protect your health, your circulation, and your vitality in a grounded, science-based way, I encourage you to stay connected, subscribe, and continue this journey with me. I'm Dr. Linda Parker. Thank you for spending this time with me, for caring enough about your future to learn something new today, and for being willing to be an active participant in your own health. Remember, you are not powerless. With the right information, one simple blood test, and thoughtful daily choices, you can protect your heart, support your brain, and walk into the next years of your life with more confidence and clarity than ever before.